let's hit it.
And welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
All right, here we go. What you think about, you will bring about.
Well, hello, everyone, and welcome back to Alzheimer Speaks Radio. If you enjoyed our opening music, it's called Clarion Call by the Mark Arneson Band featuring Maya Dore, and you can download that on any of your favorite music platforms. For those of you that are new to our show, Alzheimer Speaks is about sound information, not just sound bites. We want to raise all voices, big and small, around the world, from those diagnosed to those that care and serve them, to advocates, researchers, and more. And today is a live show, so you can join the conversation by calling in at 323-870-4602. That's 323-870-4602. And we are going to be learning today about dementia dialogues and the Alzheimer's Disease Registry, which I think are going to be just wonderful, wonderful resources and great information for you to have. But before I introduce our guests, I always like to do a couple of shout-outs. So one, I want to do a shout-out to Emerald Crest Memory Care, which is a ministry of Cassia. And actually, we are going to be doing a program this afternoon at 2 p.m. Central, so that's 3 Eastern. And it's called You Can't Know What You Don't Know, and it's about learning simple ways to explore a variety of dementia resources. And you can register by calling Christine Drasher at 952-856-7521. That's 952-856-7521, or you can email her at christine.drasher, that's Dasher with an R, at cassialife.org. So that'll be a fun event. I also wanted to give a shout out to the Project CARE. They are looking for volunteers who are currently dementia family caregivers for an important research study on emotions and caregivers' health. And you can call them to get more information at 832-819-4297. That's 832-819-4297. I also want to shout out to the Memory Cafe directory. You can explore that site by going to memorycafedirectory.com. Find out which ones are now starting in-person memory cafes again and which ones are virtual. To find the virtual ones, you go to the Cafe Connect link there. And I just want to let people know I'm still doing Arthur's Memory Cafe the second and fourth Wednesday of each month at 1 o'clock Central, so that's 2 o'clock Eastern, and we are still virtual at this point. Also want to thank Coro Health, that's CORO Health.com for allowing people to continue to download two of their apps, Music First and Choral Faith, during the pandemic. And I wanted to just let people know a couple of shows that are coming up as well here on Alzheimer Speaks. On Saturday, we are talking with a Japanese entrepreneur. He's going to be talking about their care culture over there and care farms. On Tuesday, we're going to have Dr. Cullen with the Virtual Brain Health Group on. And then on Wednesday, we have Dr. Fry, who is just a fantastic researcher here in Minnesota, who did the nasal insulin trials, which are happening all over the world now. And then on the 29th, which will be Thursday, I'm going to have actually Emerald Crest on, and they're going to be talking about their organization and their plan for dementia care and how they care. Last, I want to give a shout out to Dementia Map, which is our global resource directory, which is growing each and every day. I'm so excited about that. You can check that out by going to dementiamap.com. And on the right-hand side, there's a button that you can click on if you'd like a tour, and I will personally give you a tour. Now we're going to hear from the footbar walker, and we will be right back.
Introducing the life-changing footbar walker.
I'm Peggy from Danville, Kentucky, and I'm 91 years old. The footbar walker revolutionized my care of George. The saving that I made from having to put him in a nursing home came to about $192,000. The footbar walker opens and closes just like a standard walker. The only thing that is different is the top bar and the foot bar. Does that ever make a difference?
Does someone you love use a walker? Do they struggle to get up from a seated position? Are you a caregiver dealing with physical pain and stress as you help your patient? The footbar walker was designed to assist not only the patient, but also the caregiver. Patients have more control standing up, and no lifting from the caregiver is required. See how it works at thefootbarwalker.com. That's thefootbarwalker.com. Peggy, would you recommend the footbar walker?
Do I ever? I would not be in the health that I'm in today at this age had it not been for the footbar walker.
Well, welcome back. It's time to introduce you to our guest today. So first I want to introduce Megan Byers. She is a social worker who has developed policies and training, curriculum, monitored legislative sessions to determine their impact on vulnerable adults, and also educate stakeholders on issues of adult maltreatment and dementia. So welcome, Megan. How are you doing today?
I'm doing very well, thank you.
Well, I'm thrilled to have you with. I also want to introduce your sidekick, Maggi Miller. She is a research assistant professor at the Department of I can't say the word now, all of a sudden I'm going to trip on my words, Epidemiology and Biostatistics at the University of South Carolina. And she manages the South Carolina's Alzheimer's disease registry. Dr. Miller's research and interests include individuals with Alzheimer's disease and their caregivers, along with healthy aging as a whole and program evaluation. So welcome, Dr. Miller. How are you doing today?
Hi, Laurie. I'm doing great. Thanks so much for having me.
Well, I am excited to have you both here. The topics that we're going to be talking about today, again, are the Dementia Dialogues, which is a training program, and then the Alzheimer's Disease Registry. And again, you who are listening can feel free to call in at 323-870-4602. Now, before we get started with my line of questioning, I always like to ask my guests if they've been touched personally by dementia in their own family or circle of friends. So, Dr. Miller, do you want to go ahead and take that question first?
Sure, yes, I can. Yes, I have definitely been touched personally by dementia. My grandfather and I were very, very close. He didn't miss, one of my life events growing up, whether it be sports, school, or anything family related. He was, how can I say this, strong-willed and very prideful Italian man, but he sure had a heart of gold. After we lost my grandmother, and he reached about his late 70s, the family started noticing signs that he was becoming more withdrawn and sometimes forgetful. I think the family was in denial for a long time, which I think most families are. He was still living independently, and my mom would call him every morning and evening, and she worked right down the street from his house, so she would stop by and visit him multiple times a week, bringing him food and having a conversation. And he loved Nutella, so she would always bring him Nutella as like a special treat. I do remember, though, one time my mom was visiting me out of town, and he called her, it must have been 10 or 15 times in a row, to ask if she mailed a check for his car registration. And at first we kind of chuckled, ha, 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 because the phone was ringing, nonstop. And then I think after maybe the 10th call, she looked up at me, and she had some kind of like watery eyes. And she said, Mag, I think something's very wrong with your pop-up. And that's when we kind of realized that it was dementia. And that's when we kind of had to face the reality and make plans for the future. The family really came together, and my mom and her brothers took turns continuing to care for him so he could stay in his home. I remember, overhearing so many conversations about how to hide the keys or, how to rig up the car so, we could stop him from driving because his truck was his pride and joy. He ended up passing away a few years later, and he left a huge mark on my heart and showed me firsthand the caregiver's perspective of the everyday difficulties of caring for someone with dementia. And it's really actually served as inspiration for my career, to this day.
Wonderful. Well, thank you for sharing that with us. Megan, how about you?
I am proud to say I am actually very lucky in terms I have not personally been impacted with friends or family who have had dementia, but I have a lot of professional experience in being a direct care in the field, social worker, all the way through the legislative process to program implementation. So I'm very lucky, like I said, to not have that personal connection, but professionally I have seen various types and various degrees of dementia.
Okay, great. Well, thank you, ladies, for sharing your history with us on that. It's always fascinating to me to find out how people get into this field and how it ties in. Megan, let's start with you. Why don't you tell our audience what Dementia Dialogues is all about? How did it get started, and what is it?
Yeah, so Dementia Dialogues is a 5-module, evidence-informed, nationally registered training course, and it's designed to educate community members and caregivers, both formal and informal, for persons who exhibit signs and symptoms of Alzheimer's disease and related dementias. The program is presented by certified Dementia Dialogues instructors across the United States, and most importantly, it is free of charge no matter where you are for all participants.
That's fantastic. Free is always good. Can you give us a little more breakdown in terms of what they can expect in those different modules and how long they are, all those types of things?
Of course. Yeah, so the first module is what I refer to the meat and potatoes of the program. It is the most intense and content heavy because it's kind of providing that foundation of what Alzheimer's disease is, but also what dementia is. So Module 1 specifically defines dementia and the different types of dementia, and it identifies the statistics of the disease around the world and the United States, but we also break it down into our states as well. The Module 1 also reviews warning signs of dementia, reviews risk factors for developing the disease, treatment options, and highlights expected changes as the disease progresses over time. Module 2 is, I forgot to say, Module 1 is about 2 hours long. Module 2 is all about communication. So we discuss the importance of effective communication between care partnerships, and it identifies barriers to communication as the disease progresses and communication strategies to overcome those barriers. So we talk about the barriers to expect, but also some strategies how to overcome those. And that one is about an hour long. Module 3 is all about the environment. So specifically, we discuss environmental barriers for a person living with dementia and how to make the environment safe, as well as providing strategies for successful activities of daily living. So this can be applicable to a person who is aging in place, whether it be their own home, a family home, or even within a facility. All of the tips we recommend through evidence-based and evidence-informed research can be applied to both. And Module 3 is also about an hour long. Module 4 is all about addressing challenging behaviors. So first and foremost, we define what a behavior is, and then we discuss what a challenging behavior is for caregivers and those persons living with dementia. And once we discuss some challenges to expect as the disease progresses, we also talk about some techniques for overcoming those behaviors for our caregivers. And that module is also about an hour long. Then the last module is all about creative problem solving. The module focuses on developing a care team and problem-solving techniques for caregivers to provide care to persons living with dementia. The module also reviews caregiver stress, identifies national resources and warning signs of adult maltreatment, which is abuse, neglect, or financial exploitation, and how to locate individual state reporting statutes and reporting procedures, because adult maltreatment is defined differently state to state, and there are different eligibility criteria state to state as well. And that module is also about an hour long, just to provide the content, but I always recommend providing an hour and a half for modules 2 through 5, so we have some extra time to discuss with participants any concerns in particular that they have and anything that they have learned or come across and need some more clarification.
Wonderful. Well, that's a lot of information for people and just critical categories, too, the way you've broken that down. How can a person participate in the training, one, and then second, I'll ask you about becoming a certified trainer, how that works as well.
Yeah, so anyone can participate in a training. The best way is to contact our office. We have that website. I believe it's underneath online, but just in case, the short abbreviation is SPH for School of Public Health, .sc for South Carolina, .edu/OSA, which is Office for the Study of Aging. You'll see our program there. My complete contact information is there, and our aim is to meet our community's needs. So trainings are offered in various formats. For example, training may be small or they can be large. They can be private for a specific organization or family and friends, or it can be open to the public, meaning anyone may attend. And it's also offered virtually or in person. Because Dementia Dialogues is 5 modules, the delivery method of the program is flexible to meet your community needs. So it can be 1 day a week for 5 weeks, 2 days back-to-back, an entire day, or however else the person, group, or community wants or needs. So you would call or email me, and we would discuss what is it you need exactly and how can we meet your needs. We're very flexible, and we have trainers currently in 5 different states if you prefer to have a instructor-led. But because we offer virtual, we can meet any needs, hopefully, across the United States. And I briefly mentioned that the program is presented by Certified Dementia Dialogues instructors. So those are volunteers in our various states who have completed a Train the Trainer course and an application. The complete list of requirements and the application is on our website. But to just summarize the process for you, the potential volunteer completes an application, and then our office reviews the application and determines if the applicant is a fit to our program. And if the applicant is denied, we will follow up with the rationale and document it on the application. But once approved, the applicant must complete a Train the Trainer course, and we provide details for that. That is also virtual or in person. And those training topics include a general overview of the program, review of the curriculum, best practices for delivering the material, and expectations. And it is also free of charge.
Okay, so to become certified to do this is free of charge. That's fantastic as well. So there isn't, they can't go to the website and just sign up for an online course. It has to be provided through a volunteer then, is that correct?
It can be, we have a self-paced option, which is on our website, but if you prefer to have the instructor-led in person or virtual, we have to schedule that because we just schedule them as necessary as community members say they are interested, and we try to meet their needs as much as possible. Right now, we don't have a web-based portal where you can just register for a training or search for a training, but our goal is to get there, but right now, all of that is going to be through our office to get a training scheduled. Gotcha.
Well, that's fantastic. So, again, you can find out more about Dementia Dialogues right on the the radio page there, we have both the email address, the website. We have a link straight to Dementia Dialogues as well as to the Alzheimer's Disease Registry, which we're going to talk about next. So thank you so much, Megan. That was really helpful and very exciting to hear. People are always looking for information. So wonderful. I appreciate all the work that you're doing in coordinating this and helping families and businesses as well. So again, thank you for your time on that. Now, Dr. Miller, I want to talk to you and ask you if you can tell us what exactly the Alzheimer's Registry is.
So the South Carolina Alzheimer's Disease Registry is a unique resource for state surveillance and research, and it's used as an asset for community planning in both health and social services. The registry identifies new cases of Alzheimer's disease and related dementias on an annual basis, and we rely on physician diagnosis as coded in the patient's medical record. We were founded in 1988, so this is our 33rd anniversary. In the registry, when we talk about Alzheimer's disease and related dementias, the term related dementias refers to dementias associated with vascular disease, mixed dementia, and other medical conditions such as Parkinson's disease. So we are one of only 3 population-based state registries in the U.S., and we are the oldest of the 3. There are 2 other registries that we are aware of. There is one in West Virginia and one in Georgia. But at this point in time, there are only 3 in the nation. So a quality that makes our registry unique is its legislation. In 1990, the governor signed a law authorizing the establishment of a voluntary statewide Alzheimer's disease registry. The law has strict confidentiality requirements because confidentiality is of the utmost importance. But it does allow registry staff to contact families and physicians of persons diagnosed with ADRD to collect more in-depth data, like information related to the progression and treatment of the disease, service utilization, and caregiver characteristics. So our registry does have some 4 main goals. Our first is to provide disease prevalence estimates to advise and enable better planning for healthcare providers, patients, and decision makers in social and medical services. We seek to identify differences in disease prevalence among demographic groups. So we investigate Alzheimer's by race, age, and gender. We also seek to help formal and informal caregivers who provide care for individuals with Alzheimer's disease. And we seek to foster research into risk factors for Alzheimer's. So our registry is a very rich data source. We use data from a wide variety of sources to capture as many diagnoses as possible. We collect data from hospital records, emergency room visits, Medicaid claims data, our local Department of Mental Health, home health, vital records, the state health plan, community mental health centers, mental health and rehabilitation clinics, and community long-term care data. So all of these data sources are combined in our South Carolina data warehouse, which is a state-based data warehouse. And here they are stripped of any identifying information and are given a unique identifier. And then any duplicate records are removed, and the result is our registry.
Wow,
so
that's a lot of information that you're collecting from so many different variables. That's absolutely fantastic. So I'm going to let you continue because I kind of popped in there, but I was really impressed with how much.
It's a very, very large data set that we work with. So to be included in the registry, individuals must have a diagnosis of ADRD. The physician's diagnosis is collected from individuals' medical records, and we use ICD-9 and ICD-10 codes. An individual is then classified into 4 general categories for our reporting purposes, and those include Alzheimer's disease, vascular dementia, and mixed dementia. And then we have those classified with dementia in other medical conditions, which are other diagnoses distinct from Alzheimer's disease and vascular dementia. And those include, but aren't necessarily limited to, alcohol dementia, Parkinson's disease, and dementia with Lewy bodies. So our registry contains information related to diagnosis, such as types of dementia, and data source in which they were identified, so either through the hospital, emergency room, those sources I listed earlier. We also have demographic data, which includes age, race, gender, and whether they're currently living or have passed away. We also have information on location. So this is where the case was residing at their time of diagnosis. So that's either in the home, community, or a nursing facility, and location within the state. So we have information about their county and zip code.
So, question with location, is there a way at any point to update that if they move from their original location, just so data is updated on that, or is that just not possible? Is that just too complicated to do?
Well, we do have our registries updated every year, so we do have up-to-date information. The information we capture, though, is the location where they were first diagnosed. So that location won't change. But if they are seen by a doctor or they go to the hospital and they have a change in address, we will have that change updated on a yearly basis.
Gotcha. Okay. And, what kind of response have you had from people? Do they know they're being captured in this? Is this something that they give permission to, or is this just kind of an automatic share that has happened?
Yeah, with our legislation, it is an automatic process. So these records are collected, at all of the different data sources, and they're housed within the data warehouse. So we're able to access that data. Now, in terms of the interest of the community, Megan and I have been to different health fairs and community events, and I'm telling you, people will walk up to us and say, "How can I get in this registry?" So there's actually a lot of interest in actually being part of the registry. And basically I say, well, if you've been to your doctor, you're most likely will be in the registry. So that information is collected, on a yearly basis.
Okay. Now, is this shared with police officers at all? I'm just thinking for calls, a lot of the 911s are allowing, in the various states, allow people to call in and register somebody. So if there's an emergency call to the house, police know. Is that information shared with them at all, or is that kind of out of the realm?
Yeah, that's a little bit out of the realm, only because of our strict confidentiality. We do not have name. We don't have anything like that to be able to report to the police. Now, that could be another option, though, as a separate source, if we could get permission to be able to allow to share information with them through our data warehouse. But currently, there's really nothing set up in that regard. But that is an important area.
Yeah, that would be, if that could be done, I think that would be really, really helpful for families and police officers as well when they're going out, because a lot of times they're just blindsided. And don't know what's happening. I think of even a woman who, arm just got broken by a police officer because she was resistant and didn't understand, and they had no idea she had dementia and wasn't able to comprehend things that just hit the news. And there's just and I understand the need for privacy, and it's a thin line of balancing that privacy and then yet protecting the community at large and the individuals who are diagnosed, and being able to help them, the best they can. Have you gotten much interest from other states regarding, hey, how do we develop something like this? This sounds pretty cool.
Yeah, actually, we've had interest both nationally and internationally. We were contacted by Ireland, actually, who was interested in setting up a registry in their country. But yes, we've been contacted by multiple states. The two registries that are currently also established we spoke with them in their initial stages too in setting up the registry. So there's definite interest out there. There's just a lot of difficulty involved in linking the data, getting permissions to access the data, and then also funding available for something that's long-term.
Sure.
So that's kind of, those are kind of the main issues that we've seen with other states.
Okay, and I can understand that. Can you tell us, with this information, I would imagine that this is used for policy making and, asking for funds in terms of looking at all of these numbers and figuring out what resources are needed and to what locations?
Mm-hmm. Yes. Actually, ADRD represents an ever-increasing area of concern for families and the healthcare community. So tracking of the disease is important in many, many aspects. And one of the major goals of the registry is to release an annual report, and that describes demographic characteristics and medical information for South Carolinians living with ADRD, and we do that on a yearly basis. So I can actually share a little bit of our data from our 2020 annual report.
Oh, wonderful.
Yes. So with increased reporting and addition of new data sources, the registry is going year after year. In 2016, which is our most current year of data available, we maintain information on over 106,000 individuals living with Alzheimer's disease and related dementias in South Carolina. So we have a large number. So this is just individuals living within that year.
Okay.
We do also house the data for individuals that have passed away. So our registry is actually upwards of 240,000 individuals currently. So when combined with census data, our registry shows that 11% of South Carolinians aged 65 and older have ADRD, and 51% of those 85 and older have the disease.
Wow.
63% are women, and African Americans are at a notably higher risk of Alzheimer's diagnosis, being 57% more likely to have ADRD than their white counterparts in South Carolina.
Wow. Big numbers that are really important in order to, even out the playing field in terms of services and how we care for one another when it comes to dementia. I just find this fascinating. I'm in Minnesota. I wish we had something like this. I think it could be so helpful on so many levels. Let me ask you this, and I know that everything is kept confidentially, and yet I'm thinking, oh my gosh, this would be wonderful for trials to be able to tap into in some ways, because I know they struggle with getting to people who are diagnosed as well. Has that ever been, and again, you don't want to hound people and you don't want them to feel pressured, but yet I also know that so many families want to help and be part, and they just don't know where to start, and sometimes going to some of the trial sites is just overwhelming for them, or they don't even know that they exist. And it just seems like this would be a really cool way for people to be able to be kind of invited in, to know that even exists, or that they could assist with that as a whole, if that makes any sense.
Absolutely. And, one thing that has been a recent development in the registry is that we received formal access to address and name of individuals who have been seen at a hospital within a hospital system. Now, our legislation did allow us permission, but we were never able to get the formal permission at that level. So just recently, I'd say within the past year or so, we've gotten that permission, and we have done our first outreach mailing. So in the northern part of our state, there's a healthcare system that has a memory health clinic, and they are offering the REACH program, which is Resources for Enhancing Alzheimer's Caregiver Health, and it's a wonderful intervention for caregivers. It gives them stress management techniques and ways to deal with different behaviors, and allows them to find out more about services in the area. So what we did is we used our registry to identify individuals who were living in rural areas and who were low income, because we were getting a lot of people referred through the healthcare system that were being seen in the hospital, but we're missing other people that were in other areas of the state that were in, the areas of most need. So we were able to do a mailing to them, and we were able to identify people, even, Spanish-speaking caregivers, to be able to have access to this program. So it's been wonderful, and I feel like it's just the beginning right now.
Yeah, well, definitely. I think that is, I don't think there's enough ways for us to get to people and talk to them about what is available as far as resources, that exist out there. That is absolutely fantastic. Any stories that you want to share with us about the Alzheimer's disease registry and maybe how it has helped in terms of policy or just even I'm thinking with the doctors even feeling like there's a bigger picture going on in terms of coordinating this information, that there might be some feedback on that level as well, because I know that so many of the doctors are undereducated in terms of not only diagnosis, but giving people support. Do you find that they are tapping into your support services a little bit more, like with dementia dialogues and stuff, and what you're doing, in South Carolina?
Yes, I think that, having the registry and having the data available at our fingertips and open to the public has been very, very helpful. As Megan mentioned, we have our website and we have Dementia Dialogues, which is a free training program, which is fantastic. What, in my experience, a lot of physicians have reached out in terms of trying to answer their own research questions. So what they like to do is, they've, seen different things in their practice, and then they say, well, we have this data set available, can we do this research? And a lot of times we can, because we do have the ability to link to so many different other data sources to get information on cases. So,
cool.
So we have done some research in the past that looked at behavioral disturbances in nursing home placement. And here our goal was to identify behavioral disturbances in persons with Alzheimer's and caregiver characteristics that were influential on the decision to provide care at home or in a nursing home. So we used the registry to identify individuals that were eligible for nursing home care, and we did interviews with their caregivers, and we asked them about their lifestyle, stress levels, depression, different behavioral disturbances that they were dealing with their loved one. And what was very interesting is that once we reached out to them, the interviewers would sometimes be on the phone with them for an hour or more, and the interview is supposed to last a half hour. So, it's caregivers really do, like you had mentioned previously, they really do want to help. And they really do want to find some solutions. And, if we're able to actually get in contact with them, because they are very, very busy people, they're happy to talk, and they're happy to disclose and provide information to help with these research studies. So what we found is that key individual behavioral disturbances, which include agitation, aggression, disinhibition, and irritability, were predictive of nursing home admission, along with having a married or a male caregiver. So those were kind of our outcomes with that study.
Okay.
And then,
wonderful.
and then as a follow-up to that study, we've had physicians that are interested in exercise science. So they were curious about caregivers and their sedentary behavior, so their exercise levels, and if they're moving, if they're getting any time to themselves to walk or move around. And so what we did is we followed up with the caregivers from this initial study and gave them an accelerometer, which is basically an armband that records their steps, activity, sleep, kind of like a Fitbit. And we found that they engaged in high levels of sedentary behavior, and we know that this can lead to poor health outcomes. So basically, now we know that sedentary behavior is a health concern, for caregivers in addition to the stress, depression, and other health-related issues that they deal with every day.
Okay. Wonderful. Well, thank you. Megan, I'm going to pull you back in and just see if you have any stories about or comments that people have left with you regarding dementia dialogues after going through the courses.
Yes, we have had positive feedback regarding the program. Dementia Dialogues has been around since the early 2000s, but in July 2019 we did almost a complete rehaul of the program to make it better based off of what current research says and based on our evaluations from participants. So each module has a pre and post survey, and that's so we can understand what's working well, what's not working well, and an overall evaluation so that, again, we know on a program standpoint where we need to improve the program. And we also have evaluations about the presenter. So if there's a pattern that we noticed or a really good feedback about certain instructors, we're very engaged with our participant feedback. But from that feedback, but also just from people reaching out to me, they really, really appreciate the program. One, because it is so flexible. Two, it's free, which again is very rare for these kind of programs. And we're able to have that connection with the caregivers. And again, that caregiver can be professional or a family member, community member, to help provide an explanation and hands-on experience of saying, we're not just saying research says this. We've experienced it professionally or personally, and we're able to tell you how and why it works, and able to have that dialogue about, like, if this happens, what could happen. Of course, the program, we have our instructors are various professions, some are retired, some aren't. So the program, we have to remember that we're volunteers, so we can't necessarily answer specific case-by-case questions because we're not that professional at that time, but we can help guide you to professionals who can help further provide clarification for a specific scenario. But we actually were published in the Journal of Applied Gerontology about Dementia Dialogues, and that article provides great detail of how we updated the program and what our data actually shows, which is significant improvement in all modules. That is available on our website for free as well. So if anyone's interested in having some in-depth questions and answers, that is available for them.
Great. Now, can people get CEUs for, if they're a nurse or social worker, things like that, for taking these courses?
Yes, it is state-to-state difference because we apply state-based for CEUs. So in Utah, it is approved by the State Board of the National Association of Social Workers, and in South Carolina, we're approved for social work or general continuing education hours with our state department. I do review the different state regulations, and so in North Carolina, we don't necessarily have to get pre-approval, but the program can be approved. It's based on social workers' interest and if it meets their regulations and things like that. So for specifics, participants are able to reach out to me and I can provide some information for them. But in general, yes, continuing education is available.
Okay. Well, and I know it always amazes me because I do training as well, how different it is state to state with all of this stuff. It would be so nice if it was, all in line. It would make it just so much easier.
Yes. We're slowly working towards being able to apply at a national level for all states for various fields and various professions. But it's, as you know in your experience, it can be quite expensive. So we're slowly working on that. That is one of our ultimate goals, is have a national approval rather than we have to look at the state specifics and apply for each state. So that is one of our main goals. Yeah.
Yeah. Well, in maybe trainers in particular states will know how to maneuver that process too in order to have those apply as well. And work with you on that, because it does get expensive because every state, I mean, you typically have to purchase hours, and you don't want to purchase hours that you aren't going to use, and things there. But that doesn't mean the information is any less valuable to professionals as well. Great. Well, anything else that you wanted to add, Megan?
Just one part regarding the CEUs. If we do have, whenever new states come on board, we do work very closely with them to help maneuver the process. If a state agency kind of wants to be a program coordinator, that is totally doable. Utah is actually a partner of ours. They're merging different departments right now. Their contact information is on our website as well. So they kind of handle everything on their end for our Utah folks and participants, but they do report to our office. We work very closely with them. But other individuals, if it's just an individual interested in bringing it to their agency or their community, we have no problem with doing that. And if they want to work towards a continuing education approval, we would work with them and actually do that on their behalf. That way everything is synchronous across the states.
Wonderful. Wonderful. And I'm just going to pull Dr. Miller back in. And Dr. Miller, anything that we missed that you wanted to add?
Well, I just wanted to reiterate that, our registry allows us to investigate the impact of Alzheimer's at the population level, and it highlights the significant and multifaceted impact of Alzheimer's disease within our state. It provides a clearer picture of the types of dementia, where the cases are occurring, and in which populations the disease is most prevalent throughout the community. So having current, correct, and comprehensive data is truly the key to understanding Alzheimer's disease, and it provides robust insight for planning for all of those impacted by the disease. So we would really like to see more states create registries. I think having additional population-based data can help us have a better idea of how Alzheimer's is impacting us at the national level, and it'll help determine areas that are in the greatest need. So if, there's any states out there, any individuals that have contacts that are interested in creating their state registry, feel free to reach out to us, and, we can discuss and we can tell you our story and see if we can assist you within your state.
Wonderful. Well, thank you, ladies, so much for joining us. Again, you can go to the Alzheimer's Speaks radio page and or the blog and get their email, their website, a direct link to Dementia Dialogues, and also to the Alzheimer's Disease Registry. And feel free to reach out and get more information or sign up for the Dementia Dialogues. It sounds like just a wonderful, wonderful free resource for people, and it would be a waste for people not to take advantage of that, especially when you can do it, at your leisure. That's fantastic. So again, thank you for all the work that you're doing and taking time to share with us with all of your information here on Alzheimer's Speaks Radio today. In wrapping up, I'm just going to let people know, if you're looking for additional resources, you can always go to alzheimersspeaks.com. We have lots of information there, as well as all of our shows on the radio here are archived. So you can go back till, I think we started in 2011 doing this. There's lots of great information and wonderful shows to listen to that will give you, I think, great comfort and calm in terms of how many different things are out there to assist you when dealing with dementia. Again, another great resource is a Dementia Map. You can go there by just going to dementiamap.com. Until next week, we will talk soon. Thanks again, ladies. Appreciate your time today. Bye now.
Thank you so much for having us.
Thank you, Laurie.
Yep, bye-bye.
It's time to rethink, renew, and reimagine retirement. Hey everybody, Jared Sylvester here, host of Retire Repurposed. Now this podcast is about the non-financial parts of retirement, which many times can be even more challenging than the financial. We believe retirement is not the end, rather the beginning of what could be the most impactful, purposeful, and fulfilling season of a person's life. So don't retire. Become repurposed. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.